My presentation will deal with injuries that involve the end of a bone. And by that, I mean, we'll look at injuries that affect articular cartilage, that affect the subchondral bone plate, and affect the bone, the subchondral bone beneath the plate. We're going to study the way in which injuries extend through articular cartilage to reach the subchondral bone. And we'll do so using anatomy and pathophysiology to enlighten us as to why we see what we do on the imaging studies. Our main focus will be on collagen and bone trabeculae, as you will see at the time of the talk.
I'm going to cover two major topics, which is one about postoperative imaging of femoroacetabular impingement, and also imaging in patients that underwent total joint replacement.
I'm very hopeful that following the presentation, when the participants return to their jobs and begin viewing MR examinations, particularly those that involve injuries to long bones, they will understand better what they are viewing on the imaging studies. They'll understand exactly how cartilage fails, how the subchondral bone plate fails, and how the subchondral bone fails. All of the findings will have new meaning. That is what I hope. And again, I hope I'm successful at it.
So we do know a lot about femoroacetabular impingement and how it looks on MR and radiographs. But what is not so well known is what kind of postoperative changes do we have to expect and how do they look like? It can be quite tricky to figure out what was done and how things were done and what findings to expect. So I think that's an important finding. And then, of course, we're going to talk about a lot of things that are related to total joint replacement and the complications that we see in these patients, some of them which are very subtle, and you have to look very, very thoroughly in order to find them, and some which are more straightforward. And then I also want to talk a little bit about some newer techniques and concepts about the capsular ligaments and of the surgery of the gluteus medius and minimus tendons.